Okay. All right, we're going to get started here. If I could have your attention, please. I am now going to talk about Equity-Centered Policy Unit at the Center for Black Health and Equity and the work we're doing with our grants. Okay. So the Equity Centered Policy Unit was started when I was hired in 2021, and it is me as the Director of Equity Centered Policy and Mary Williams-Stover. Mary, if you want to wave and say hi. Mary is our Policy Manager. And at Equity Centered Policy Unit, we do many different things to support the center's main mission and work. So at the center in general, what we do is we build community capacity. That's very important to us. And we support the creation and growth of community infrastructure. And we also develop and promote equity-centered policy. The Equity-Centered Policy Unit focuses a lot of our effort on the equity-centered policy piece, but we still incorporate the community infrastructure and capacity building into the work that we do. And hopefully you'll see all three of those components in the work that we'll go over today. But for ECP, we really believe that investing in communities and providing that high quality service that they might not get when it comes to the public health institutes that are meant to serve them, that we fill in those holes and that we provide them with the support that they need to advance health equity in their communities. And so the mission of our specific department is to build on this mission and to build on the three things that the center does, and then also help communities identify, develop, and discuss what does it mean to center equity in policies and thus advance health equity. We do have a section of our website. If you go to centerforblackhealth.org under the issue tab, if you go to equity centered policies, we have some terminology that we use to discuss equity and health equity and a bunch of resources, including links to our podcast. I'm the host of our podcast, which is Black Body Health, the podcast. We have a bunch of really interesting episodes kind of connecting these bigger systemic issues with Black health issues. It's some really fun episodes. And then we also led the center's work in creating the 2023 State of Black Health Policy Platform. So hopefully you were able to grab one of those at some point during the conference. For the external work that the Equity Centered Policy Unit does, we actually work with many different partners to accomplish a lot of things. But the main thing that ECP wants to do in our work is to make equity-centered policy more accessible to communities. What does it mean to engage in the policymaking process? And then how do we identify the real root systemic issues driving health inequity in our community, and what are the equity-centered policy solutions to resolve those problems? And we're doing that through two grants. One of our grants is funded through the Office of Minority Health, and it's called the Framework to Address Health Disparities Through Collaborative Policy Efforts. And we also have our grant from the W.K. Kellogg Foundation, which is Building Capacity by Centering Policies in Equity. For both of these grants, we've been given this opportunity that we don't normally get in public health, which is to actually get to the root cause of public health issues. Normally, our funding is meant to address specific health outcomes like commercial tobacco-related death and disease or HIV. But this gave us an opportunity to look into the non-traditional issue areas that we know drive health disparities. So things like transportation and other policy issues that really impact these social, economic, and environmental conditions that impact our health. And so with our funding from the Office of Minority Health, we are working with three really amazing partners that you're going to hear from today. We have Dr. Helen Holton and Associates. Dr. Helen Holton could not be here today, but I believe she's watching virtually. So Dr. Helen Holton, if you are online, please say hello to the group chat. We miss you, we appreciate you, and you're here with us in spirit. We also work with the Public Health Law Center led by Manire Vaughn, who will be on stage in just a second. And then we have a great team from Meharry Medical College that will be on stage, led by Daniel Dawes, who is right over there, the infamous Daniel Dawes, and Nelson Dunlap, who will also be on stage in just a short minute. With our Kellogg Foundation grant, we are working with two really amazing community partners. We have Ashé Cultural Arts Center, hello, out of New Orleans, Louisiana, and Making It Count out of Detroit, Michigan. So we're first going to turn our attention to the OMH grant. What's really important to note about the OMH grant is that it's more focused on the policy analysis aspect of the work. We still, as you'll see, are trying to bring in the community component. Because the purpose of this is really, again, to make policy more accessible. So we want to do the work to assess the policy. We're doing a legal epidemiology analysis, but then we want to bring in the lived experience of the community, fund community members to provide their lived experience as qualitative data. And then through our analysis of the OMH work, we want to create a dissemination resource that will be helpful for all communities to take in and be able to advance health equity in their community. So we will start with our OMH partners. I'm going to invite the Public Health Law Center folks. We have Manire Vaughn leading the work at PHLC. Manire currently serves as a lead senior staff attorney for the climate justice team at the Public Health Law Center. And as the leader of PHLC's newest program, he endeavors to use the law as a tool to support affordable housing, community-based organizations, and environmental policy experts to eradicate systemic impacts of environmental justice. So Manire, please join us on stage. We also have Tonya Curry. Tonya Curry is a senior staff attorney with the Public Health Law Center, who is also on the new climate program. Tonya has a ton of experience even before her time at Public Health Law Center, serving as Deputy Commissioner of the Georgia Department of Community Affairs and having 25 years of experience in state government. We're so happy to have you, Tonya. Please join us on stage. We also have Safia Abdinur. Are you in the room at any? Safia, oh, say hi. Safia has also worked on this grant with the Public Health Law Center. So thank you to Public Health Law Center. And as far as the Meharry folks go, again, I said the infamous Dawes on our team. We're so happy to have him, but he will be taking a seat for now because we've got a full agenda. But we have Nelson Dunlap, fearless leader, who I just heard was recently made the 40 under 40 de Beaumont list. So let's congratulate Nelson on that. But Nelson is the Vice President for Public Policy and External Affairs at the Institute of Global Health Equity at Meharry Medical College. Before joining Meharry, Nelson actually served as the Chief of Staff for the Satcher Health Leadership Institute at Morehouse School of Medicine, where he helped to lead the government relations and health policy initiatives of the institution. So Nelson, please join us. So for the OMH grant, what we had the opportunity to do was to identify one component of systemic racism that drives health disparities. At first, we thought, let's just do what we know how to do, which is to work on commercial tobacco policy, like the regulation of flavored tobacco products, and figure out how that drives health disparities in certain jurisdictions. But we actually worked with a community collaborative in both year 1 and year 2 of our grant, who agreed with us that we wanted to take advantage of the opportunity to use the funding to identify something that's different, something that we're not familiar with, but something that we know for a fact impacts things like commercial tobacco-related death and disease. So we decided to look into transportation policy. How does transportation policy impact, say, commercial tobacco related death and disease? How does it impact the environmental change that comes if there's an inequitable transportation policy decision, the lack of green space, lack of public transportation and access to medical care? We wanted to look into this deeper systemic driver of health inequity, and we chose transportation. So before we get started with questions, I'm going to play a short video because I'm not going to assume that everyone in this room understands how transportation can drive health inequity.
It's hard to picture American cities without highways running through there. But highway removal projects like this one in Boston, can you give us a sense of how disruptive it was when the US built huge highways through the cities after World War II?
These new highways will have a far-reaching economic impact on the entire nation.
That was definitely true. Highways revolutionized the way we transport goods, but inside cities, they demolished and isolated entire neighborhoods. They gave local taxpayers a way out of the city and gave air pollution and traffic noise a way in. And then you design urban life around the clock. Now 85% of Americans drive to work every day. So why did American cities agree to build highways that were bad for cities?
It's a really interesting question, and part of it goes all the way back to the 1930s, when a group of auto interests, such as General Motors, AAA, formed something called the National Highway Users Company.
They began lobbying for taxes that would help fund highway construction. General Motors started to design what a new highway system would look like, and they displayed that vision at the 1939 World's Fair with Futurama, an exhibit featuring expressways that not only connected cities but ran right through them. It was a design that allowed for more cars and less congestion. By 1955, the Department of Commerce echoed GM's vision with something called the Yellow Book. It laid out all the routes that interstates would take throughout the country under Eisenhower's Federal Highway Act of 1956, which funded the national highway system.
A lot of logical is, connecting both of the US major cities, but the really interesting one is you also have highways slicing right through the downtowns of many of these cities. Pretty much every major city in the country, New York, DC, San Francisco, Philadelphia, you have major highways cutting through neighborhoods, requiring the demolition of lots of housing and other buildings.
That's largely because some contributors to the plan, including industry members, but no urban planners.
And that's because the profession barely even existed at the time. Nowadays, there's a value placed on preserving neighborhoods, on keeping cities intact, and that concept just really didn't even exist in the 40s and 50s. When people were talking about connecting the country with highways, it's being natural just to drive highways through the center of cities as well.
Local municipalities were particularly eager to build highways to this plan because 90% of funding came from the federal government and the other 10% from states.
There's also a government side to the reason why all these planners wanted to build highways through downtowns and urban neighborhoods.
Highways not only paved the way for more and more white people to move into the marginal suburbs, they also provided cover for targeted demolitions inside the city.
During that era, federal policies and implicit priorities of planners dictated that you had, vibrant, dense downtown neighborhoods built with African American residents. Instead of being preserved under the plan, they were slated as targets for, they were considered blight, and an easy way to get rid of that blight was by demolishing them and taking the highway through.
Neighborhoods and streetcars were redesigned to make way for the automobile.
Look at the neighborhoods of Black Bottom and Paradise Valley.
When you go back to the 30s and 40s, these are thriving and dense neighborhoods filled with 100,000 residents, businesses, and if you go back today, there was that grass plots.
This wasn't just initial tax. It became a habit in cities across the country, or in residents for this place, they look for highways. And white residents use those highways to commute into the city for jobs and then move back home and out.
The only exception to this matter is in places where highways in the state is built with low neighborhoods.
They weren't actually proposed to the highway people in West DC and through Greenwich Village in Manhattan. But you can yes, there.
Anywhere where residents have the means to organize and protest, they were often able to someone highways are being built. Whereas in places where residents didn't have a political capital and others with privileges that allow you to do that, their neighborhoods end up being demolished and they're now on highways to.
Even before he signed it.
Okay, if you can hear me, clap once. Can you hear me, clap twice. Thank you. Okay, so as you can see, transportation policy on a federal level, state level, a local level can have tremendous environmental changes, destroying neighborhoods, and then ultimately impacting our health, right? So that's what we've been working on together through the OMH grant. Okay, let me go back here. Okay, so through the OMH grant and the opportunity that we got to identify a deeply systemic issue, we were able to do so through a legal epidemiology assessment. Has anybody heard of legal epidemiology? Raise your hand. Okay, so a few hands. Legal epidemiology is really a way of showing through research the health impact of a law or policy change, in short. And so our research question for our legal epi assessment was, what are the health impacts of the environmental conditions that were modified by certain transportation policy decisions made in the past? And how has that development impacted residents? So for example, we looked at 5 jurisdictions. So we would ask, for example, in Atlanta with the Sweet Auburn neighborhood, if anybody has heard of it, how did the construction of the I-75, I-85, or the downtown connector impact the lives of residents in the Sweet Auburn Avenue community of Atlanta with the environmental change? The environment changes when you knock everything down and build a highway through it. So that was our research question. And what we hypothesized through our legal epidemiology work was that these historic transportation policy decisions, federal, state, or local, they would lead to environmental changes in these neighborhoods. And then this environmental change, whether it's a reduction of green space, housing being destroyed, the economic center being destroyed of neighborhoods, that this would have an impact on residents' health. And then this would lead to health disparities, right? That makes sense. So that's our hypothesis. And so for our legal epidemiology assessment, we basically had the goal to measure that environmental change after looking at these historical policies. So now I'm going to turn to my panel of my partners that I love to work with so much. In the beginning of this project, we originally, like I said, were set to work out on a policy that would directly reduce one of these health outcomes, which is tobacco-related death and disease. And so we were working with our community collaborative, and it was clear that there was a deep desire to really focus on those deeper drivers of health disparities. After our discussion, we decided to investigate the impact of inequitable transportation policy and how it really has damaged these historically thriving Black communities across the country. So what were your biggest takeaways from these discussions with our community collaborative about going deeper? And why do you think that transportation policy was a good systemic, deep, rooted issue to focus on?
I'll take the first stab at this. So thank you, Natasha, for the introduction. I work at Meharry Medical College, like you said, the Institute of Global Health Equity, which is going to be a precursor to the School of Global Public Health, which will be the first accredited school of global public health at an HBCU. And thank you. One of the key tenets of the work we'll be doing there is the political determinants of health, right? And it's the notion of looking and moving upstream, moving away from just the theoretical, just the academic, and actually trying to implement change. And so these conversations we had with the CPI collaborative, with the folks that are doing the work, what they pushed us to really do and focus on was, how do we fix this? Can you hear me?
Sorry, Nelson. I'm having a hard time hearing you. Could everybody please minimize their conversations? I think people are having a hard time hearing in the front too, please. Thank you so much, Nelson. I'm sorry.
Okay.
Go ahead.
I'll try to speak up as well. So to answer your question, we had these conversations with folks who were closest to the pain, closest to the harm, and they were asking us, what are we going to do about this? You have a hypothesis, you have a plan for research, but what's the actual outcome of that? What's the actual implementation? And that challenged all of us to really to stop and think, how do we move the needle forward? And so those conversations allowed us to really kind of consider, what do we do with legal epi? How do we actually, effectuate change? And how do we build that into our research process to begin with? And so I have to say that interaction with them was super vital. It helped us really kind of understand what we were doing and stay true to the perspective and the point of the research project.
Yeah, thanks, Nelson. Can everyone hear me? It sounds like yes. No?
Louder.
All right, perfect. Now, I'm not at church, but I stand up if I have to. Anyway, thank you, Natasha, again, Manire Vaughn from the Public Health Law Center. And really the choice to select transportation as the thing that we wanted to go deeper on, I think was a great choice, in part because as public health professionals and practitioners, it is our job to be responsive to the communities that we serve, right? And the way that we do that is by cultivating our understanding of what's going on in the federal government. So in the midst of this project, we learned that the Biden administration planned to dedicate trillions of dollars to infrastructure, right? And the idea was to improve American infrastructure across the states. And in doing so, $20 billion were to go specifically to communities that, were historically disenfranchised or did not have the same investment, right? So again, us wanting to be nimble public health professionals, we said we have to dig deeper into transportation. And in digging deeper, what we learned is transportation has always been a part of the movement, right? If I say Montgomery, Alabama, we think of two things, right? The great folding chair debacle that happened, right? And the second, right? And the second thing we think of is the Montgomery boys boycott, right? Both of these things involved what? Transportation, right? One, a bus, the other, a boat, right? But not only did they involve those two things, but they also were great examples of how our people stuck together, right? To fight against racial oppression, to fight against inequality, right? So transportation seemed perfect. And what better way to illustrate this racism, but thinking about highways and how these highways, whether you're in New York or Oakland or wherever you are, these highways are in our communities. So we need to take a deeper dive and understand what the hell is the health impact when you put a highway in my community, when my folks have come from Mississippi and Alabama and wherever to start over new, but now there's a big ass highway in the way. So what exactly are we doing to think about those health impacts and what those barriers are? So transportation seemed perfect, and I'm happy that you trusted us to go forth with that.
Absolutely. And again, the work that we do with ECP is all about equity. And I want to one more time ask, please, if you could minimize all conversation. There are some people who are hard of hearing, who can't hear in the front. Please do minimize your conversations. We really want to hear everything the panelists have to say. So through our research, we were really looking into federal, state policy changes related to transportation and potentially the related health outcomes to those. What are some findings, and maybe we can start with you, Manire. What are some of your findings from the research to date that either surprised you or was significantly impactful?
Yeah, so let's set the stage. It's 1956, right? So this is before the Civil Rights Act of 1964. So this is an incredibly tumultuous time in our nation, but Eisenhower decided that he wanted to connect all the US cities. And in doing so, he wanted 41,000 miles of interstate. The only caveat that he had to the states was, you have to connect the suburbs to the downtown areas. Anyone that's a student of history or sociology knows exactly what was happening during that time, white flight. So the idea was, let us go ahead and connect these white folks back to the downtown so they can go to work, right? In addition to that happening, across the country, we have states that are voting down, and there are all these court cases that are striking down racial covenants and ordinances that are all about redlining, right? So people are big mad. So when they find out about, this money that's coming from the federal government, they're like, bet, watch us work. And what they did was they decided to place these highways in the middle of communities, right? It wasn't let's go around. No, we're going to go smack dab, right? Because the understanding was these are slums. But how many of us know these were not slums? These were the epicenter of economics in the Black community, right? So Rondell, LA, all these different places had these great things that were going on, but the urban planners, mostly white men, decided to place highways right in the middle. And when that happened, people dispersed. So between 1950 and 1970, a little over 1 million people were displaced, right? 1 million folks are displaced. 450,000 households are displaced during all this construction. So what was surprising in doing this work is, knowing all that has happened, still in 2023, we have jurisdictions that are not looking at the proximity to hospitals, the proximity to clinics, to any of these neighborhoods. Why is that important? Because research tells us that cars emit all these different pollutants, one being particulate matter. And if you know anything about particulate matter, you know that it is a trigger for things like asthma and cardiovascular disease. Yet, these Black communities are right next door to these highways. So why are we not looking at the proximity to hospitals and clinics, right? In 2023. So that's a racial equity issue, but even bigger, a health equity issue that our communities are still plagued with. I'm from Chicago. My granddaddy got asthma. I have asthma, and we grew up right next door to the highway. Mm-hmm. So my question is, where my settlement check at? But that's the reality, right? That's the reality. And I think that's what's most surprising, is that we're still in 23 and we're contemplating, why are we not thinking about hospitals and clinics and access to those things so people can be well?
Great. Yeah. So I want to take just a pause to talk about what we're doing here, right? We say we're doing a legal epidemiology study. That's a big 10-cent word. You gave a definition, but for a lot of folks, I only saw a smattering of hands. They might not understand what we're doing here. It is September 8th. Joe is expecting me to start paying my student loans again the next month. Those loans are from law school, so I have a little bit of training in this and a whole lot of PTSD as a result of it. The important thing about this is the breakdown of this is us trying to do a rigorous, scientific, quantitative approach to what we already know, right? Is to look at the policies, look at the impact, and put numbers to it so that we can see trends. That's the long and short of it. Trying to understand what is happening, the impact on our communities, and seeing the trends of it. We had a hypothesis. We met with our groups. We know what's happening in our communities, and so we would assume that it's the same kind of playbook over and over again in each community. The reality of the situation is when we look at these 5 communities, Atlanta, St. Paul, Cleveland, Oakland, H-Town, in the great country of Texas, you realize that sometimes it's not the same thing over and over again, but it's having the same outcome, the same impact, right? And so when I go back to that earlier conversation about the political determinants of health and moving upstream, I was concerned, or I was shocked to see that it's, some states and some local localities have ordinances on the book that do require you to look at the proximity to schools with respect to, or youth facilities with respect to tobacco retailers, or they consider the location and the proximity to healthcare facilities, but some don't. But in all 5 of them, we're seeing disproportionate and disparate impacts on communities of color. So what does that tell me? It tells me that their playbook might be different, but their game plan is the same. And so for us, we have to have the same approach. We have to make sure that no matter where we are, no matter who we're talking to, we explain to them, you have to move from the downstream, you have to move from those social determinants of health upstream to those political determinants of health to make sure that my brothers in Chicago, even though we're going to pray for him, are still getting that settlement check. And so it's like the folks in Texas are getting the settlement check. And one thing at a time. We're going to pray on that. So for me, I was shocked to see it's not the same thing everywhere, but it's the same problem, the same harm, and the same fight.
Yes, thank you. Thank you, Natasha. And you all can see I have a lot to work with these guys. Yeah, I mean, I think that it was, and again, my name is Tonya Curry. I'm with the Public Health Law Center. I joined the project at the beginning of this year in year 2. And so coming into the project, and I also live in the Atlanta, Georgia area. And so coming into the project, I was tasked, along with doing some of the legal epidemiology work, to actually work with some of the hands-on work in the community. And I think to answer your first question, Natasha, what surprises did we see, or what types of things stood out? I think it was particularly clear and particularly blatant, as Manire pointed out, in the Auburn Avenue area, when you put a side-by-side picture, a 1958 picture next to a 2022 picture, it was clear as day what had happened in that time period. And so I know we're going to talk a little bit more about how we took that to the community, but we did bring those types of visual prompts, if you will, to help them kind of remember and think about what happened. And that really led to some of the deeper anecdotal and firsthand information that we received.
Thank you so much. So you already mentioned law school, that, unfortunately, but we're all lawyers. And I, love working with Black public health lawyers, first of all. But let's talk about policy and how inaccessible it can be. So I had said that the Equity Center Policy Unit at the center, our purpose is to make policy more accessible. And so for non-lawyers or non-public health professionals, they sometimes don't understand how to get involved, how policy impacts them. And it's inaccessible in that way. If you know that there's an ordinance that's being proposed, it might be inaccessible to you because you cannot take time off work to attend a listening session or a public hearing. It might be inaccessible to you because you've got too much else going on, or you actually literally cannot get there because of transportation. But it's also inaccessible in these ways of understanding. And what do you do when you don't understand that a policy is passed? How do you change it? Inaccessibility to access your political power and make change. And so in this project, we've acknowledged that inaccessibility to policymaking and incorporated these aspects into our work. So when we're looking at the historical and current lack of access to policy or lawmaking, how have we really done that? I mean, when it comes to acknowledging that in the actual assessment itself, and in our work to build in community engagement to make sure that the community lived experience is a part of our research. And I'm going to turn that over to Nelson, then Tonya, we're going to flip over to the community.
Yeah, I think we have to be very clear that the inaccessibility that you're speaking about, that we all feel, is intentional, right? We're talking about, the unfamiliarity within communities of color with the impact and the import that policy plays in their lives. That's intentional, that there was a decision made to, obfuscate the process, to make it so that we don't know how this thing works, so that we can't make it work for us. That's intentional, and we have to know that enough is enough, right? To that end, I'm appreciative of your leadership because you've made it very clear to us that we have to address that in this. We're using legal epi as a tool, as a resource to see the trends, to highlight what we already know and what we already feel intrinsically. What we do with that next is put it into easily accessible, digestible, a resource that others can use so that they can become aware of what's going on. So when you ask how are we, ingratiating this, how are we building this into the work we're doing, we're making sure that whatever we do with the numbers of 1 + 1 = 2, to make sure that we can then pass that out so that everyone on the street corner, everyone in the churches, in the barbershop, everyone whose grandparents were living in Sweet Auburn and now they're fighting for their home equity now can understand you have to mobilize, you have to get active, you have to raise your voice. You don't have to do it alone because there's an organization in Puerto Rico that's working with a whole group of folks who look like you. They're willing to do the work. But it starts with us understanding and acknowledging our inaccessibility to it is not our fault. It's because the game was rigged against us. But enough's enough, and we have to fight to overcome that.
Thank you. Tonya?
Yes, I was just going to add, it absolutely is everything that Nelson has said. And from the community level, one of the first things that we did was to really bring some level of the political process to some of our first meetings. So we had local politicians there that were able to communicate their role in the community and explain some of how the policy process starts and how the laws and the policies are put into place. And again, it's a patient process. It's a building process. It's not a one-time meeting. It's a continuous conversation. And it's something that has really grown over the time that we've spent working with the community. But I think you also have to engage those politicians and bring them to the discussion. And when they are helpful and friendly, that's the best way to do it. And thankfully in the Atlanta area, we had a couple of politicians that were able to participate.
Manire, what you have done a lot of the work to the preliminary work when we were trying to see, okay, well, we see the problem, but what is being done about it across the country? What are some promising and effective policies, practices, or actions that you have seen that recognize, address, and then potentially maybe mitigate the effects of this type of systemic racism, like racist transportation policy that was passed long ago?
Yeah, so the state of Washington, their highway transportation policy center, they decided to do what's called a racial equity toolkit. So it's a toolkit that was developed by GARE. And essentially what the toolkit does is it goes through a series of questions. And I think someone presented about that earlier today from Bloomington, Minnesota. But it's a really great toolkit that asks, I think, poignant questions all about racial equity in any endeavor that you inspire to do, right? So one of the questions is, who holds us accountable? And I think that question is very important, right? Because as we do this work, we have to make sure that we're, one, holding ourselves accountable to our constituents, but also holding ourselves accountable to the ancestors and folks who have come before us. The second question that, the racial equity toolkit asks is exactly what does it mean to engage with community, right? And I think a lot of the work that we've seen across the country, they're not engaging with the community, right? The community is kind of the afterthought. But I'm a firm believer that ask the community for what's going on and they'll give you the solution, right? But it requires you to do that. It requires you to actually talk to the community and engage with them. And then the last thing is, and there are 6 questions, but the other question I think is important is, it asks us who's set to benefit and who's going to be the burden. And I think that's super important when we're talking about any community planning, transportation planning. We have to understand who's set to burden and who's set to benefit, and understand how do we make sure that those scales are leveled. But also, if they've been historically unbalanced, what are some of the interventions that we need to do to make sure that they're back balanced? So I would say the state of Washington, they're doing really great work with the racial equity toolkit. So look them up for sure.
Thank you. And so we mentioned, our engagement with the community being extremely important to this project, not just keeping it high level policy analysis. It's really important to us at the center to continue to engage with community and build their infrastructure to get community members paid well so that they can participate, not only learn for themselves, but also to help us and give us direction for what we should do. So throughout the entire project, we engaged with a community collaborative that we called the Centering Policies and Equity Collaborative. And we met with them throughout years 1 and 2. And in year 2, we decided to focus our efforts on one of the jurisdictions that we are researching, which is Atlanta and the Sweet Auburn community. And here you have a photo on the screen of Sweet Auburn when they just started with their construction of I-75, I-85, or otherwise known as the Downtown Connector. This Sweet Auburn neighborhood was the thriving Black community in Atlanta. It's where Dr. King was born. It's where there was just so many historical landmarks, such a huge economic hub, and it was just ran through with the freeway and really had a big impact on changing that environment and impacting health outcomes. And so our community collaborative for year 2 represented legacy residents of Sweet Auburn. And legacy residents to us meant people who were born before the Downtown Connector was constructed and who lived through that and saw that change, but also residents who have a legacy connection. So it might be younger residents who, for example, we have one member who is a 4th generation business owner still having a lounge open in the Sweet Auburn community. So people who have always gone to church at Ebenezer, people who have that family connection or that community connection to Sweet Auburn and can speak to not only the change, but also what they want to see in the future. And so we did some engagement in year 2 to reach out and have a great community collaborative set up this year. It's going to end soon. And I want to give a special shout out to the Fulton County Senior Services, and then also the Heart Coalition in Atlanta for helping us engage in that resident work. So if you could please give that up for them. And Tonya mentioned that we hosted a listening session, and we want to thank the Auburn Avenue Research Library for their participation in the grant as well. So Tonya, you spoke a little bit about working with the collaborative in year 2. Is there a common thread through the lived experiences that the community members have shared that you found to be very impactful and important to pull into our research?
Absolutely, Natasha. And when we started doing the work on Auburn Avenue, so much thanks to Dr. Helen Holton and to Mary. We were all there together working, starting with, just flyers and giving them out up and down the street. And for someone who's lived in Atlanta for 30 years and who, I don't want to say takes for granted that area because I might be in it several times a week. It was really a wonderful experience just to be, walking up and down the streets and communicating with people. So we did that to pull people in. And I think one of the common themes that we saw was that they're still there. The community is still there. The people are there. As you mentioned, the 4th generation business owner. And when I learned more about him, Mr. Woodson, I realized that his mother was a judge, his grandfather was did several different businesses, and he is continuing that legacy. And so what we did, we just built on that. We kept talking to people and hearing from more and more people about who they knew in the community. And that was such a big thing. They're still here. Every time we set up another meeting, and we had 3 or 4 different types of community meetings, different types of settings. And we realized that the more we talked, the more people came out and the more they had to share.
And they were aware of how the environment had changed because of the Downtown Connector?
Oh, absolutely. Because as you mentioned, the collaborative itself, we had some kind of demographic characteristics around who we wanted to hear from, because we wanted it to be people who actually had knowledge of that time period. And many of the seniors, of course, they may have been 7 or 8, but they had those stories about, for example, how one day they went to school and when they came home from school, their house had literally been moved away from where it was 3 blocks away, same house, because the Downtown Connector was coming. And those types of experiences, really had a profound effect. Or maybe they would go further uptown to different businesses, all their life. And those businesses, those markets, those shoe shops, those barber shops, those things were not as easily accessible to them. So those were definitely some of the things that they right off the bat shared with us.
And if you just think about that, I mean, we had one of our breakout sessions was about, community conversations in barbershops and how barbershops are a really important place to share health information. And so you can imagine all this environmental change and all of the dominoes that fall and how that can impact our health. So we're just about out of time. There's so much that we've discussed today, and this project has so many different components. I'm sure that there are people in the audience that are wondering, where to go from here, how to get involved if they're interested in whatever you work on. If you work on tobacco, if you work on HIV, if you work on food and nutrition, how to connect what you do to the deeper systemic things and maybe even transportation. What is one piece of advice that you have for the audience in how they can connect the dots from the work that they do to these deeper systemic drivers of health inequity? If you were to give one or two calls to action, what would that be?
I guess my main call to action would be to, really dig as deep as you can into the community. Take that time to find those elders, take that time to find the people that have the knowledge of how the area has changed or how the topic has changed over time. Because the more time you spend, the more you can get out of it. Sometimes we tend to be a little bit impatient with the work that we're doing. But for me personally, it's been an opportunity just to listen and learn and really gather the information in an extremely thoughtful way, because there's not a conversation that we've had that hasn't led to another conversation and more information that we've needed. So do that deep work.
Nelson, Manire, anything quickly you'd like to share?
Yeah, I see we're at time. So I'll just say this: support, empower, and encourage the youth, right? And I think that's super important. Yesterday, it was really heartwarming to see the young women from Mississippi who are civically engaged in making a better Mississippi for the future, right? And we need more of that. We need folks that are really going to pour into the youth, because this is a relay, right? And we have to know when to pass the baton when it comes to health equity work and racial equity work. So if there are youth in your community, pour into them. To the youth, listen, the elders know what they're talking about, right? But also understanding that respect goes both ways in making sure that we're continuing to do this work. So pour into the youth, work with the youth. I know sometimes we're hard-headed, but please, this work is important, and it's imperative that we pour into the youth for sure.
And very quickly, I would say, first and foremost, I'm of a certain generation. My parents are of a different generation. So my father would always say, well, you got a good job, don't mess it up. So if you're looking for something to do, some way to connect, continue to connect with the Center for Black Health and Equity, because they will continue to keep you plugged in. But if I'm going to leave you with one thing, it's exactly what Tonya said about what we're hearing from the folks in the Sweet Auburn neighborhood. And we're still here. And that's just that concept of resilience. We're all still here. There's still work to be done, but don't forget, we are still here, so we can still be resilient.
Thank you so much. Give it up for the OMH subcontractors.
Well, you always act like you're so old.
And as they exit stage, I'll just say now we are exploring steps for dissemination, sustainability, and evaluation. So if you'd like to discuss that with us after the lunch panel, please come up to the corner of the room, and we would love to engage with you. So next, I'm going to talk about our Colleg work, which is our engagement with some really strong community partners in New Orleans, Louisiana, and Detroit, Michigan. With the W.K. Kellogg Foundation, we have done a couple of things through what we're calling our Truth Be Told, storytelling for equity-centered policy change work. With our Truth Be Told training and framework, what we've done is to identify 2 communities that are already engaging in really great work to advance health equity in their communities. And we wanted to support them in the work that they were already doing, but to help to engage with them on a new way of doing things that would make policy making a little bit more accessible and would also allow them to look at one of those systemic drivers of health and equity in their communities. And so we work with the Ashé Cultural Arts Center in New Orleans and Making It Count in Detroit. Yes, round of applause. And with them, we engaged with them to do a community health needs assessment. Once that was completed, and we've had some discussion with them about some of these major health and equity issues in their community, we actually produced 2 videos, one for each community that you're going to see today. We're going to do a premiere. And those videos are really impactful. We actually just won an award for both videos at the American Public Health Association's Film Festival. So we're very excited about that. And then we got into the work. So that's when we started our actual Truth Be Told training series. And what that is that we have a training on the importance of storytelling in general. We have a training on Health Equity 101. What is health equity? And then we did Law and Policy 101. And the Law and Policy 101 was an important training because at the end of that training, based on the community health needs assessment, based on the discussions that we've been having with the community partner to date, we created a policy menu. So both community groups, as you'll hear, wanted to focus on mental health. And so the policy menu identified several options at a state and local level that were available to them to start working on. And they're already doing a lot of work already. So, but the opportunity to do the Truth Be Told training ties together storytelling and somebody's individual lived experience. That's all you need to engage in then policy making. That's the whole point, making policy making more accessible with just your story. Truth Be Told, storytelling for equity-centered policy change. And at the end of the training, after they've gone through storytelling for equity-centered policy change, they then can develop their elevator pitch and go into the community, have community events, and then train the community so that all they need is their story and telling a story for effective equity-centered policy change. So now I'm going to bring up our panelists, but first I'm going to bring up my colleague, policy manager Mary Williams Stover, to the stage. She is with the Center for Black Health and Equity and works with me on ECP. And then I want to recognize and welcome to the stage our partners at Ashé Cultural Arts Center. We have, first, I'm going to want to recognize Asale Ascleses, our Chief Equity Officer at Ashé Cultural Arts Center. Ascleses. I know I wrote that phonetically and then somehow it messed me up here. But thank you for being here, Asale. And then Avis, could you join us on the stage? Avis Gray is presently the leader of health equity with Ashé Cultural Arts Center, and she provides leadership to community health workers. So Ashé works really a lot with community health workers to engage with residents and help them, and that's how they advance health equity in that way. Avis is a nurse and has received her RN from the Charity Hospital School of Nursing, and has spent years working in a large public hospital, which has led to a desire to really impact health management and start her 23-year public health journey. Monica Millon, please welcome, come to the stage. Monica is a longtime community worker and resource connector through her life's work as a stylist. She was connected through Ashé through her children, actually. Her children were engaged with Ashé, doing art activities, and developed a deep reverence for the organization and the work that they do to close the life expectancy gap among the Black community in New Orleans and providing the community with the resources to have a good quality of life. So welcome, Ashé partners. And then last but not least, of course, we have Minou Jones from Detroit, and the founder and CEO of Making It Count. Please come to the stage, Minou. Minou is well known throughout the state of Michigan and obviously throughout this conference for her work on substance abuse prevention and community development. She is a certified prevention specialist and currently serves as chair of the Detroit Wayne Oakland Tobacco Coalition. And she's a former executive director of the Black Caucus Foundation of Michigan. So welcome to the stage, all the Kellogg partners. So, you know, the communities behind this equity-centered policy change work that we've been talking about today, the communities are the ones that actually are the fire, the engine to keep things going. So could you talk a little bit about, you know, your different roles in public health, in social justice? Tell us what it's like working as a Black-led, social justice-oriented public health organization on issues that you also face in your individual lives and are very overwhelming at times to deal with, especially during COVID and things like that. Minou, would you like to start?
Thank you, Natasha, and thank you for having me up here. the mantra, the name of my organization, making it count, right, has been my mantra for many years as a Black woman who grew up in the city of Detroit, lost a lot of friends to gun violence during the crack era, have family members affected with HIV, AIDS, and just all that we go through, right? I was a single mother of 4 Black boys. Making those moments count, for something beyond me, and providing the platform for others to contribute their lived experience. You don't need a PhD. The community, we are the experts. And so we have to provide a platform for them to take that lived experience and bring about the solutions that work for us. And that's what it's about.
Thanks, Minou.
For me, hello. For me, I worked years in the hospital system as an ER nurse, and I worked in the state system, working in a true equity environment to make a difference. I saw the other end, and I always wondered, what is going on that I am consistently seeing the same problems? We have a 25-year difference in life expectancy between people of color and white people in New Orleans. And we have an organization that is on its 25th anniversary, Ashé Cultural Arts Center. And what is so wonderful about this is that we have an opportunity to use culture bearers and artists. It came out of pandemic, all right? Because there was a reach out, people of color are dying. We have been dying for decades, but we were dying exponentially. So they had to come to an organization that is a cultural organization to say, can you go to the community and get them to believe in this? Well, yes, historically, we do not believe in government and in hospitals, but you have a cultural arts center who's been at this work for 25 years. And so now it's time to change and make a change. We've been 50th in the nation. So that means that the existing systems have not been able to move the needle. It is time now for us, by us, cultural bearers, artists, community. We can make a difference. We can make a change, and we will.
I'm just very proud because at Ashé is Black woman led. Our program, I Deserve It, is Black woman led, and our partnership is with a hospital in New Orleans East Hospital, that's also Black woman led. So just that in itself is very empowering, the historical aspect of it, and then just moving forward in that direction. So I'm very proud to be a part of this team and organization working on this work.
If you had to give one piece of information about what you would like people to hear about appropriately equity center work with Black-led organizations, what would that be for funders or for the major organizations that maybe fund some of the work?
I think someone said it earlier in the last panel discussion. If you're looking for sustainable work, you have to be funding and supporting the work at the community level. When the bills don't go forward and they get kicked back and you have to start again, we're still here. When government officials, when you retire, when you transition to different work, I've seen just in the short time that I've been doing this work, which ain't so short, but I've seen so much turnover, right? The community, we're still here. And so we have to be about bringing the resources to the community, recognizing the community as experts. And we know what's best for us. And we're going to be here when you go on to your next job or retire or whatever, we're still here. So the investment in the community is key to sustainability and being in the long game. You have to invest in the community.
Also, I think a lot of time the funders are looking at quantitative data and just numbers and data. And it came up in a lot of meetings this morning that we're putting a lot of the same negative data out there, and we're not showing entities that can make an impact. Look at qualitative data, look at storytelling, look at the impact that community can make, that the historical fundings that you have been given out have not been able to make. And going back to what Minou said, we are here. When the state changes, when the city changes, all of those people move out. The individuals who are in the community are here now. They'll be here tomorrow. They have been here historically, and that is the individuals that can make a change and a difference.
So you mentioned the community being the experts on issues impacting the community. We're going to play your Truth Be Told videos for each of you. Is there anything that you'd like the audience to pay attention to, or something that they should look out for when they watch the videos?
I think the videos will say it all, and I'm excited for you to share it. It's a powerful tool.
I'd like to say, once again, when we talk about the culture bearers and the artists, the richness of our culture, and that we're looking at making changes within our culture, but respecting this wonderful culture that is our city. But that is what the driver of what our program is, the culture bearers, the artists, and the trusted messengers and the influencers they are. And that's what I want you to see here.
I just want you to think about the medium that you're about to experience, and that certainly we can produce a report, but taking that information, listening to the voices, and then transitioning that information into a video speaks volumes.
I'll just also add that some of the participants you'll see in our video are part of our program. They are culture bearers and artists, which are trusted members of the community, but they're also storytellers and working artists. So it gives you an idea of how you can use people, I don't want to use the word use, but how you can empower people within their own communities to do the work through their artistry.
Thank you. Okay, so first up, we are going to watch Truth Be Told New Orleans.
The culture of New Orleans people has always informed and reflected its language, art, food, and material values. But the culture of the bearers of New Orleans is that the Black people who lead direct into a society celebrating our world are not provided with basic tools to their own democracy.
Vaughn at one point. And then something out. That we have to live with. There's one part then pretty much typically you know, almost to the feet. I have to seven, bring up two, see a lot, not all the other, and she came on. Which is very critical. It has a problem saying, you know, it's the only clothing store within this 2-mile radius that first Black community. How do you specify? Yeah, we are one that incorporated sound to bring billions of dollars to the city stage. So that's a huge toll on our community. Not just those people who have their jobs, but our young people who structure. And the extent of another system, a lot of it fall
talk about the direct correlation. Lack of economics, the lack of progress, is indirect.
These children are being victimized in homes that are I don't even have the right word for that. To know the information that I access to here.
From a juvenile facility and bring them to the old death home and go to maybe the detention. When I was 10 years old, I was involved and at the time, I was working on I was convicted of all kinds of for fitness, actually. Like, into good about having people.
There's a great need for mental health. A great need. The crime here has just ballooned into something that's inconceivable. I just have lost 7 of my friends to this violence. 7 of my friends have been killed by this violence. So that is in a way I can't even articulate when you think about your friend. You know, we look at the history of New Orleans, we're talking about, not the history of New Orleans, but we're talking about the history of different places in general. We have developed so much in a culture of violence. We've developed so much in the culture of poverty. We've developed so much in the culture of mental anguish and angst. So the thing is, right? How to be well in an unwell society.
We truly need the culture of the society is how we operate, how we rise from the crack around. So we try to alter power. We know that everything about the world is based on African American and color.
So one program that came up with called Building the Ancestral Women's for a lot of times. We're looking at, let's say, at balance at the same time, hard. At the same time, while we're looking at people that have to diabetes, cardiovascular health. Because what choking us is the brain. So you have then you do the modifications, but then the beauty of that process. They're trying to set that. And that's what has been lost in so many of the activism, public health, medicine. You don't respect the culture.
And so this is where you talk about the idea that hope that I have in there, right, for like those that are together, that we can, I don't just like it, we also believe the right to make the whole system situation that we rise up for not only for ourselves, for our company, for our organization, for our family, for our families, for our neighbors, for everybody to continue raising to young, raising, setting for us to be at the direction as they have been to deny us. You know what I'm saying? We come up with the same thing.
We deserve to live our lives, right, by support the communities and save neighborhoods. We have a right to affordable place and and health. It is here, the whole claim, I live When the collective eye comes together, unified, dignified, and aware, empowered by one another's existence, knowing we are all contributing from every little thing this life has to offer.
Okay, so I really love that video. And what I really love most about the New Orleans Truth Be Told video is the showcase of the resiliency, the beauty, the culture, the art, the engagement with the community for that healing, that bringing immunity into the community. And so we see too very clear that not only are there all these systemic inequities and health disparities, but then there's the mental health as a result of all of that. And health disparities persist for African-American communities, but our culture still remains a strong foundation for resiliency. Ashé, you have a unique health initiative. It's called I Deserve It. It's very exciting. Can you please share with us that model and how you engaged I Deserve It with storytelling and advocacy?
The great thing about I Deserve It is Ashé has been working for decades in community using culture. And out of COVID, there was a reach out because they knew that Ashé was a trusted environment to reach out to community. What is so great about this is that we are not just stopping with the I Deserve It as a reach out to look at vaccines and look at COVID. It is the underlying causes. So I deserve it. When you look at our wellness manifesto, I, as I am, right now am good enough. Okay, because I come from kings. Okay, and I deserve all the social determinants of health that everybody's talking about. I deserve access. So this is a community it's people from the community, it's culture bearers and artists. And what we're doing is that we're doing wellness messaging. We're reaching out to community because there are going to be more diseases that comes. There are going to be more disasters where we are evacuating sick people. How do we empower and build within our communities? How do we do more than a hands out, but a hands up? And so this is about empowerment. And what I love so much about what we're doing with the Center of Black Health Equity in Meharry is another thing that's so important in these times is how do we do storytelling and lived experiences to impact policy? We have to be empowered to impact policy and to sit at the table with the policymakers.
Thank you. Monica?
I'll just also add that, and I always ask when I'm able to speak on this and coming from a tourist city like New Orleans, for everyone to consider that the driving force of our economy is culture bearers and artists, and they are some of the most underserved people. So the beauty in our program is that not only do we utilize culture bearers and artists for the messengers, but it creates sustainable income for them also. You're talking about people that live off from gig to gig. They don't have life insurance. They don't have health insurance. So our program is twofold. We have employed culture bearers and artists to give them, they can rely on a paycheck, but then also they are trusted members of the community, right? So they're relatable. They also have a platform that people may achieve to be. Children love performers, right? They love artists. They get to see in a practical sense that you could be doing something that you love, right? And that everyone can benefit from it. You know, your artistry is just as important as anything else in the world, if not even more important. So I think that's what's unique about our program and why storytelling is so important, because if you hear a story of a culture bearer, they'll tell you how art saved their lives and how art is a healing modality.
Well, thank you both so much. And we're going to get back to some more questions. But first, we're going to transition to Truth Be Told Detroit, which, again, I hope you see kind of the systemic drivers of health inequity, but the resiliency as well.
He want to hang the three for high. He asked me if I would do it, and so in the next few days, I just come on my bed, and I go to black people to and he said something to me that nothing about this. He said, black folks have to eat white job. You get the job. We've been into the know in the rest of the talk experience. What makes us is that, you know, we tend to have line of documents. We can have maybe, you know, those that have more close and those that have none. We talk about the church having more negative character, church creeds, but when it comes to this, connection, without that. It's not like you really got involved, one meeting, and 6 million dollars, $2 million.
When the automobile flowing industry cut, it exacerbated here
Maybe you draw the in this city, over there. It was so bad, we moved them as 5 hours. They moved them around. When we first got, we think of that one, they're sure we're not making. They're losing that because they have to stop the email and you want to have to pay your copy. You have to go and request it, you get a remove something and allow, and it will go on that. No. And so they're. Very hard. I was telling you that's why we look at the effect of there because of the aggression that the city had. They would come 7 o'clock in the morning.
He had to be made a lot and he's thinking, where am I going to get it? Who's the call that my dad is not having? There's been proven
that even black money are truly different in the system of life. The care and the black people give it more respect to do black people never did. Yeah, all the way to people reflect all that happened in the very kind of people everything. I think my favorite song. I didn't know this year when I read mine. We have to take our game. You know, it's a different way to get. We need to like go spot, credit. Let's start that. Let's get people to then they need for them to provide that not the skills already. We're gonna come. We'll change the mindset for young people. So you didn't control the environment. As long as that, I really have changing this. You don't have to do it because so many opportunities are lost. Because one thing that they've done, which impacts us to them, meeting where they are, they try to find they have specific and it provides, we got a child, we got all kinds of issues, we got that, anxiety, we got attacks. We had issues, right? We had some issues.
The way we look at the world changed. You have to and your God based on it. Whether it was right or wrong. And then you have to be right. It wasn't. So I'm looking at the principle that I was good.
You know, I said, people were, your representatives about, I think the way. Because that is be able to sustain and be able to advocate by the policy resilience of some of his lives. We're gonna write really and push through the agenda. Here we are.
Great. So again, this idea of a community that is coming together. There's so much culture there. There's so much history there. There's so much power and resiliency, but still plagued with so many issues. So Minou, you are, well ingrained in Detroit. Detroit is you. I think when I think of Detroit, I think of Minou. So we heard in the video from community leaders and media and advocates in the short film about the power of coalition building and the work to educate and engage with the public in fighting for policy change. How have you utilized the coalition or coalitions that you work with to engage with others on the power of storytelling for change? And what lessons can you share with others who are interested in getting involved but don't know where to start?
Thank you. You said I was from Detroit and I'm in PR. So I got to give y'all a Detroit welcome. I didn't do it to begin with, but I just got to do it. So what up, though? And I answered a question in a Hoover app. And, if you haven't seen it, this will help. When we think about voting, the importance of voting and voter suppression and, getting people to register to vote, the reasons that we've given, because your ancestors, blood, sweat, and tears, because I said so, because it's the right thing to do, because you turned 18, because boy, you better. The storytelling piece in the way that it was delivered through the Center for Black Health and Equity, the training, us identifying people who have been impacted at different levels. people that have received mental health services, those who are afraid to start with mental health services, those who work in the mental health service industry. Bringing those people together for this training, right? It gave them an opportunity to see themselves in this policy work, right? So again, that's part of sustainability. That's part of empowerment. And that, when you do that part and you take this toolkit and start sharing it with your communities, you empower them to be able to tell their story in a way that will impact elected leaders to think twice when it's time to vote. That is an amazing reason for people to recognize that, oh, wait a minute, my story can impact policy change. And there's voting that's associated with this. I put the people in the office that's going to make decisions on the behalf of Joy Road and Sussex. Yes, I'm going to vote. Yes, I have a story to tell, and I know how to tell it in a way, in 5 minutes or 2 minutes or 1 minute, that will get people to stop and think twice before they make that decision of yes or no. It's critical. It's a critical tool. And so, you know, this project, in using the tool in that way, I'm excited to go to the next level and share this toolkit, the videos, the trainings, empowering the people who have gone through this training, some of which were able to come to Puerto Rico this time, to begin to share that information and build up the army that we need to address all of these systemic barriers that are stopping us from reaching our fullest health potential. I'm gonna live to be 100, and I expect y'all to be living long too.
100 and well, 100 and well. Thank you, Minou. So in both of the Truth Be Told videos, we saw your community health needs assessment, your work to date reflected. But for the purpose of the Truth Be Told work that you've been doing with Meharry at the center, the issue that both of you decided to focus on was mental health. And so you wanted to focus that as a primary health outcome, and what are the policies that can impact or improve on public health in your communities. And then we went through the Truth Be Told training, and we narrowed with that policy menu into some specific policies that could advance mental health. So my questions for both of you, both groups: do you consider there to be a mental health crisis in your community? And what solutions have you explored through this process or even beforehand to address the mental health crises in your communities, if you feel there is one?
I'll start. One of the great things that we found, that we worked with one of the leaders in our region and the state that is over behavioral health and addictive disorders. And we narrowed our policy statement down to looking at youth, because we knew that we had a lot of youth violence. And so how do we impact that and make a difference? How do we, as this community trusted voice, because so many, and this is what was wonderful about it, the musicians, these are individuals who can talk to the youth about their addiction and how music, how the arts, what impact that made. So having artists and culture bearers be part of that discussion about addictive disorders and behavioral health was so important, because they've lived, they had the lived experiences. They could have that conversation, and then pulling behavioral health into the conversation. So now we're prepared with this training and this toolkit, which will not sit on the shelf. We can go now and train all of our staff, train the community, so that we can go to the council meetings and be impactful. We can go to the legislative session and be impactful. During this time of changes, and with a governor's race coming up in Louisiana, what's happening on the national level, if not us, who? If not now, when? So this is so right on time, that we understand the importance of policy. We understand that we have a voice. And this, to me, is empowerment for our community, because so many of the social determinants of health and those issues have to go back to the racist policies that are in place. So now we are empowering ourselves and our community to impact policy.
Thanks, Dave. Monica, did you want to add anything for New Orleans? Yes, just no, that's okay, Monica. So just the fact that both groups are focusing on mental health and mental health issues and policy that could improve public mental health. What you think about mental health in New Orleans and what you've been talking about to address that through policy.
I would say that if I could just go back a little bit, I'm a native New Orleanian. I was born, raised, reside, family's been there for generations. And the mental health crisis for me, number one, is displacement. We too had an interstate driven right into the historic Treme neighborhood, which is one of the oldest Black neighborhoods in the country. It's the birthplace of jazz and many other art forms. And it was driven right into the middle. So you have that displacement, the history of displacement of Black people. And then you had Hurricane Katrina, right? In New Orleans, we are very, very proud of where we're from. You know, people claim their wards, their schools, you know what I'm saying? Like, this is really important to us. And it makes me think about, when I think about mental health, my grandmother used to always say, everybody need a base. And what that means is you need to know your community. You need to feel safe as a child. You need to know you have a community surrounding you and loving you. So the crisis is that in displacement, and changing the neighborhoods, we don't even have a school district anymore. All of our schools are chartered. This is a very layered problem when you look at it. It's that our children are like guinea pigs. You have these test subjects, and then you expect positive health outcomes to come from this. So what you have to do to me, and when I started looking at policies, I started looking at policies that impact community organizing. We need to come together. This is not our problem. This is everybody's problem. We can't work in silos and think that we are above it or that these aren't our children. These are all our children. So if children don't feel safe and feel connected, that equates to abuse to them. Like psychologically, if you don't have a sense of belonging, your body interprets that physically, mentally as abuse. So if you look at it through that lens, then it will make sense why we should focus on policies that encourage community development, engagement, and organization, and then it will benefit children in the long run.
Yeah. And Mary, I don't know if you wanted to say anything about the engagement of community health workers, that we are just so proud that's what Ashé has been really putting a lot of effort into. So I don't know if you wanted to speak to that, but.
I'm so pleased that the Center for Black Health and Equity understands the value of culture, number one. And that culture eats policy for lunch. Even though we're talking about the power of policy change, we're starting with the power of the story and the lived experience. And so having the opportunity to partner with organizations that are community-based, that are rooted in understanding their community is smart business, but also the way to get things done for the long systemic change that we need. And I am just so thankful that the Center for Black Health and Equity understands this, works it, and makes it happen on a day-to-day basis.
And Minou, did you want to say about mental health in Detroit and your work to address that?
I mean, so, you saw the slide. You said it says 75% of Detroiters suffer from PTSD. I'm saying that number is way higher because you're talking about the reported number, the diagnosed data. Yeah, we're suffering. And I would say or ask the audience, raise your hand if you know someone that needs mental health help and has not had it. Exactly. So doing this work, when we think about all of the problems that we face, right? Drug addiction, tobacco use, gun violence, suicide, that is on the outcome side. That is the symptom, right? That's not the root of the problem. You know, and we learn in this field that if you take away somebody's coping mechanism, right? Weed, pills, tobacco, and you don't give them something else, a healthy replacement, the services that they need to get to that root issue, they're just going to pick up another bad habit, and it might be worse than what they were previously using. So yes, in order to address what's happening, right, we have to be about providing access for our people, by people that look like us, without fear of, hey, my son is in a crisis. He talking about hurting himself. He talking about killing somebody. I don't know what to do. It's Sunday. It's after 5 o'clock. Y'all not at work. Am I going to really call the police to help my Black son? Oh, no. And you can fill in that, would I pause? No, I'm not. Am I going to take them to the emergency room where they're going to wait for hours on end before they can see somebody, only to be told that I'm about to put your butt in handcuffs because you got to go over to the hospital and wait for 3 days to get an assessment? There in Michigan, we don't have licensed nurse practitioners have to work under a physician. There is a whole bunch of Black and brown educated, licensed nurse practitioners in Michigan that could be a point to help us out if the policy changes that would, and it allows them to practice independently. That's a policy issue that will have a positive impact on access for people that look like me.
Absolutely. And we will be definitely disseminating all the information from the continued work with Kellogg and Truth Be Told. Can we please give a round of applause for our wonderful Kellogg partners, Ashé Cultural Arts Center and Making It Count LLC. We don't have any time for question and answer, but we really appreciate all of you staying with us through lunch. And please feel free to come up to the table on the left if you'd like to discuss, again, dissemination of any of our OMH work or the work that we're doing with the Kellogg Foundation. Thank you so much.